FCJ Refugee Center is a non-profit organization that was funded by two refugees from El Salvador, Francisco Rico and Loli Rico, and they are still being our co-directors. In general, we have settlement services, we have a primary care clinic for non-status people, we host women with children, we have adult education, and something very important is that we have a youth network. We have a vibrant youth group. Then if you have any youth in your family, I encourage you to let them know that they can join us. They have meetings every Wednesday in the afternoon. They do trainings. It's a really nice way to connect with others, especially now that we are in a pandemic and we cannot go out, that we are again locked in our houses. Okay, today we are going to focus on the temporary pathway to permanent residency. Probably as many as you know, the public policy was announced on August last year, and until December 14, 2020, Immigration and Refugees and Citizenship Canada was more clear about how was the procedures, who could apply. Then since December, IRCC had been receiving these applications. Then the government recognized that many people had been working as a personal support workers or as a nurse assistants, working in hospitals, in homes for seniors, and they had been exposing their lives and risking their lives and their families. That's why they launched this program and recognized also that many refugee claimants that were waiting for the hearing were part of these persons, and unfortunately some of them passed away. Then this is also to recognize the family members that are still in Canada, that the spouse passed away because contracted COVID-19. Also, something about the pathway is that recognize the time that some people that are studying PSW, Personal Support Worker Program, as you may know, they need to do like an internship, like a training. Then the government recognized if the person was doing the training, the occupational part during the pandemic, those hours can count towards the program. Then, in general, the requirements are like who can apply. Then, if you claim protection before March 13, 2020, if at one point you were issued a work permit, and then you had been working in the healthcare sector. I know many people have been confused and asking, okay, if I work in a shelter as a social worker, if I work as a security guard in a hospital doing a screening, why I don't qualify? Unfortunately, some people already have applied and have been refused because they don't meet the requirements. And one of the requirements is that you need to be part of you need to be part of these specific designated occupations. Then most refugee claimants, what they had been doing is working as a personal support worker or nurse aides. Then is somebody that have been working directly with patients or working in nursing homes. I have a couple of cases that they were working in shelters, and they said, I have been working with COVID patients, some people that got infected in the shelter, but they had been refused. Then unfortunately, we welcome this program, but it's so narrow that not many people can apply. Then now we have more clarity about that. There was a lot of confusion when this program started, but again, it's only if you are in one of these occupations. And another issue is that some people, even they had been working as a PSW in a nursing home, they don't qualify because they don't have the 120 hours between March 13 to August 14. We have a case at FCJ Refugee Center that the person is short 8 days. Then what you should do. Some people, even they are short with this time, they really want to apply. They try to apply, but you need to seek legal advice about this, because if they refuse you, it can bring, depends of your status, then it's better to make sure that you comply with the 120 hours between March 13 and August 14. And remember that you can include the practicum part that after you were doing your PSW course, those hours can count on the 120 hours. Also, if you are working in one of these designated occupations, you also need 6 months of experience. Unfortunately, you will, if you have the 120 hours, that's the most important part. If you have the 120 hours from March 13 to August, but you don't have in total the 6 months experience, immigration is providing you with time until August 31st, 2021. Then don't worry, you don't have the total 6 months because you will have until August this year to complete it. There is still some requirements that you need to be admissible, means that you don't have criminality or security issues. Because this is part of a permanent resident application program, then anybody who wants to become a permanent resident in Canada, they cannot have criminality or security concerns, okay? And those still apply. And again, also one of the requirements is that your employer provide you with a letter, and the letter must state the NOC. The NOC is the National Occupation Number, and these are the National Occupations Number, especially for those that are doing support work. Is the NOC is 4412. Because most people that are refugee claimants, they are no licensed practical nurses in Canada, but another people that qualify that we have been seeing is orderlies and patient service associates. That the national occupation number is 3413. Then you need to make sure that the work that you are doing is according with the description of the national occupation number. You can go to the website, IRCC website, and look for the NOC. and you type, for example, NOC 4412, then you will see the description of what exactly is that unit. Then how it works. Then in general, if you are a refugee claimant and you are waiting for a hearing, then when you send the application for the pathway, because you make sure that you qualify, that you had the 120 hours, that you had the 6 months, that you have the NOC number and the letter from the employer, then you apply. Then you will receive a letter from immigration saying that they acknowledge that they received the application and you have an application number, and they will send notice to the Immigration and Refugee Board saying to put on hold your case. Then if you are waiting for your hearing, then the IRB will put on hold your case, and then you apply to the Pathway program. And if for anything you don't qualify, then your case that was put on hold, your case of refugee protection, it will restart again. Then you will go back to the IRB and your refugee claim will restart again. Also, the IRB, there is a regulation there that says even if you send the Pathway program, but you already have a hearing and you have submitted evidence and your hearing is scheduled and they are almost ready for you, then they want to proceed with your refugee claim application. Then again, if you have a lawyer that is managing your refugee claim, you need to talk to the lawyer and seek legal advice. Then what happened if, okay, I apply, if I send the application and you get, okay, this is how it's going to work. The first email that you are going to receive, because most of the time they contact you through email. The first email is saying, yes, we acknowledge that we received your application, everything is okay. And then you will receive a letter from immigration saying that you were approved in principle. Then it means that they want you to start sending documents for your permanent resident application. Then they are going to ask you to do your criminal record, to provide your valid passport, to do your medical exams again, and then they will continue, and you need to pay the permanent residency fee. Then at the end, when they said, okay, now your case was approved and you are permanent resident of Canada, then that's the moment that before they said you are a permanent resident, you need to withdraw. Then again, it's not with the first letter that they said that you were approved in principle. With that letter, you cannot withdraw your case. You need to wait for another document saying that you are almost, your case had been finalized, and they will ask you to withdraw the case. Because some people have been confused and said, okay, with the first letter that they sent me saying I was accepted in principle, should I withdraw my case? No. Remember that at that moment you are going to start going for to apply for your permanent residency. Then it will take again a couple of weeks or months. Then you will receive a letter saying your application is almost ready. At that moment is when you withdraw your application for being a refugee claimant. That's really important to have clarity about this. They will ask you to send a notice of withdrawal for your refugee case, or to the Refugee Appeal Division if you are doing an appeal, or to withdraw your case from the federal court. If the IRB receive a letter saying your pathway was refused, because again, we have been receiving, some clients have been saying, I applied by myself and I was refused for the new pathway, then your case will continue with the IRB, or your appeal will continue. There is other people that have been telling me, for example, I qualify, but I haven't applied to the new pathway because I'm waiting for my appeal to be resolved. Please don't wait, because if your appeal is resolved and it's negative, then you will have like a removal order against you. But now then you are going to start your application. Then again, don't wait for them to resolve your refugee appeal. Both things can go at the same time, because if you send the pathway application, remember IRCC will send a notice to the Refugee Appeal Division saying, please put on hold this appeal until we decide the case. In that sense, you will be like protected. We know that the minister promised that they are not going to remove anybody that will tell them, I applied to the pathway, or I'm going to apply. But it's better to be secure that if you know that you qualify to apply at the same time that you are waiting for your appeal. Remember, your appeal will be put on hold, or your refugee claim will be put on hold. I'm telling this because this week I got a call from a client that says that he was waiting for the appeal, and he didn't apply for the pathway, but unfortunately this week he received a negative decision from the appeal. Then it means that now he and his family will be without any more protection. Then now he's desperate to put this pathway as soon as possible, when he could put it since January. Okay, if that's your case, please seek legal advice or talk to us to see if you want to start the application. In general, I already talked about this, that if you are doing an appeal to the to the Refugee Appeal Division, or if you are doing appeal under the judicial review to the federal court, again, both of them can be put on hold, means that you ask them not to render that decision until you receive a communication from immigration about your new pathway application. If you already sent a humanitarian and compassionate application, then you can move your application to the new pathway. At FCJ Refugee Center, we have around 4 cases that the client sent the humanitarian and compassionate application like October, November last year. And because they qualify for the new program, they are rejected refugee claimants, but they qualify. They were doing personal support working in nursing homes. Then we requested IRCC to move the application to the new pathway program. Then you need to send a fax, and the fees that you put into your humanitarian and compassion application, those fees will be moved to the new pathway, because the fees for the humanitarian and compassionate are $150 for each adult main applicant, and $150 for a minor, for a dependent. Then it's the same as the new pathway. Then we just need to transfer. There is one form, like a schedule 1, that needs to be filled out, because it's the new one form that it appears in this new application, and they need to send proof of the employment letter, the NOC. Also, we are sending proof of that they have been that they did the taxes in 2020 as a proof that they had been working. Then you can transfer the humanitarian and compassionate to the new application too. But you need to make sure that yes, you qualify. The general information that I just explained to you, you can find it at from immigration, from the official website. Then I don't know if some of you have some questions. Then I will go and check if there is any questions. Sometimes when we go through the questions, that will help us. Okay. Okay. Mayra is asking, people working with the government of Canada processing COVID tests apply to this program? No. It doesn't apply to this program, unfortunately. We have been, many organizations, we have been getting together, especially with the Canadian Council for Refugees, that is an umbrella organization. We have been getting together and talking to members of parliaments, talking to the minister, and requesting that they should have to amplify this program. But the answer is that the conversations with the government of Quebec were really hard, and the government of Quebec refused to put more essential workers into the list. Then we are asking them like to come up with a new program for essential workers, like people who have been cleaning buildings, for those that work in grocery stores. We know that essential workers, people have been designated as essential workers, but only personal support workers and orderly and aid nurses are the ones who have been benefited to the program. Then we are requesting them and asking them to why don't have a new program and include all the essential workers. Okay, let me see. Okay, other question is, people who do have diploma of personal support working, but working with patient can apply under this program. Hayden, if you have if you are a PSW and you are working with patients, but remember, you must be working 120 hours from March to August. And you need to have 6 months. And the 6 months experience, you can acquire it until August 2021. And also, you need to be working, if you are working like in private homes, unfortunately, doesn't qualify. But if you are working in private homes because you were hired through an agency, then you qualify. But if you are doing PSW like as a private person, sorry, you are not included in this program. Nana, did you say that someone who took a PSW course can use their hours to qualify for the period from March to August? It's not the period that you were studying. It's the period that when you study as a PSW, you need to do a practicum time, like going to an an agency and work there, like to practice what you learn, like the placement time, like the internship time. That's the time that qualifies for the 120 hours that you can put it together. It's not the time that you were studying. No, the 120 hours that covers the practicum part is from March to August, but that you were doing your placement, like the practicum in a hospital, when in a nursing home. That's the part that you can use. But if you were only just studying, I have cases that people were studying from March to August and they start the practicum in September. Sorry, you don't qualify. If you don't have a PSW diploma but working with patients, can apply under this program. Hiding again, you need to be to have the PSW, and because agencies and nursing homes only will hire you to work as a PSW if you have the diploma. Then if you were working as an orderly, yes, then you qualify. But go and look into the NOCs. At the end of this presentation, Carolina Teves, who is the person who put together the presentation and who is assisting me with the webinar, she's going to send you the PowerPoint presentation. Then you will going to go and get the NOC. If like the NOC for orderly or assist nurse aides, you qualify and you can get a letter from your employer. But if you don't have a certificate as a PSW, you cannot be working as a PSW with that agency or hospital or nursing home. Ruth. So does it mean if you are working as a PSW and did not work between March 2020 and August 14, 2020, but you have the hours, you cannot apply? Yes, Ruth, you cannot apply. You must have 120 hours from March 13 to August 2020. If you were not working 120 hours, then you cannot apply. If you are a rejected refugee claimant, you can apply to the humanitarian and compassionate, because then your application can be strong. But if you are waiting for your refugee hearing, then you can apply. Okay, Judy, what about a living caregiver? Can she qualify before the end of this August? Judy, no. If you are, this is not for living caregivers. This is only for PSW and orderly or aid nurses that are working in hospitals, in nursing homes, or in private homes, but through an agency. So HAP. If a person professional back home and has been working in the NOC classification can qualify, Suhab, you need to get a letter from the institution that you are working with. Hayden, okay, thank you. Okay. Then I think there is no more questions. Okay, Jane, how about if you are working with an agency as a caregiver with qualifications of small courses here and there? Do you qualify or need some special qualifications? No, caregivers are not part of this pathway. It's only personal support workers. If you are working as a nurse, as elderly patients, but caregivers, sorry, are not part of this program. That's why we are asking the government to put a list of more professions or other people that have been risking their lives, but caregivers don't apply, don't qualify to this program. Okay, then I think this is everything. If you need more like you have more questions? Also, I think I want to mention that if you apply for your Pathway program and you get your permanent residency, but for example, I apply and my husband and my children are outside Canada. What is going to happen with them? Then you need to become first a permanent resident, and then you need to do a sponsorship application. It's not, they will not be granted permanent resident at the same time as you. No, you need to become a permanent resident, then you need to start a sponsorship application to sponsor them, to bring them to Canada. But if your family members are in Canada with you, then they need to be included in your application of the Pathway. You need to pay for them to be included, and then they will receive the permanent resident at the same time. Okay, Ruth. Let me see if Ruth is asking if I can unmute her. Ruth. Okay. Carolina, can we unmute Ruth? I don't know if that's possible. Ruth, can you unmute yourself? Now. Okay, no.
Hello?
Yes.
Yeah,
yes.
You can hear me now,
okay,
right?
Ruth, yes.
Thank you so much.
Yes, I can hear you.
Yeah, so just a clarification. I know you said if you did not earn hours, 120 hours between March 13, 2020 to August 14, 2020, right? You can't apply. Is that what you said?
Yes, yes.
So my question is, I know we are saying, what about in terms of, because the program says if you maybe get denied for your appeal, you can still apply for this program, right? So if you're denied for your appeal, so the hours between March and August still counts, or that's a bit, it's not a bit. So you're saying that the people who are still working for PSW, let's say somebody worked between March, for example, somebody worked between March to August, however, they did not make 120 hours, so they don't qualify.
Yes, they don't qualify.
And then after that, if somebody is also working, maybe let's say the person who got denied for the appeal is still working as a PSW and now has even more than 750 hours.
No. That's why we are asking. Okay, we are asking the government if they will consider taking away the 120 hours.
Okay.
Because as I put an example, we have a case that the person is short 8 days.
Okay.
You must have. That's one of the first things that you need to qualify. 120 hours. And for that 120 hours, you can include the time that you did your practicum. But it's 120 hours from March 13 to August 2020. If you don't have the 120 hours, I have doesn't matter that now you have 1,000. You must have 120 hours. Then recently, we were asking the minister if they can consider to reduce the requirement of the 120 hours, but we haven't heard anything from them. Because again, they said the negotiations with the Quebec government were really hard, and they don't want to move or to reduce anything. But yes, you must have 120 hours from that time. And we know that this is excluding many people that have been working as a PSW, risking their lives, but they don't have the 120 hours.
Yeah, it's really, yeah. The other thing is that you did say that the caregivers, they don't really qualify? Is that what you said? They are not
No,
in that,
no.
they don't qualify for the program.
No, they are not in that category.
Wow. Thank you. Thank you.
Okay. Suhab says that you need to prove a degree in Canada. No, this is for PSW. If you want to apply as a personal support worker, yes, you need to have a study as a personal support worker. But if you go back to the people that qualify, there is orderlies and other people who assisted nurse. For those, you don't need a degree, but you need to have an employment letter that exactly describe the NOC, the national occupation, and says that you are doing that. But if you are a PSW, you cannot work as a personal support working in an institution if you don't have the training. Some people is asking, okay, then I'm going to start studying now as a PSW. Well, we don't know if the government is going in the future to do a new program for PSW. Then if you want to study, it's because you want to work as a PSW, but not because you believe, oh, probably the government again is going to do a new program for new PSW and the pandemic is going on. Okay. Okay. Then thank you for being here and listening. And again, if you have more questions, then you can contact us. You can contact FCJ Refugee Center, and then we can discuss more in details about UWs. Okay, thank you so much, and have a great week.
Question, one before you go. Yeah, I was just wondering, are there any clients you know who have been granted the permanent residence through this program so far?
I have clients that have received the first letter saying you are approved in principle, and now they are filling the requirements to become a permanent resident.
Okay.
Means they need to do medical exam, they need to request the criminal record from back home, those things.
Okay.
But I don't have a client that got already the permanent resident, no, but they got the first letter saying you were approved in principle. We sent the application in January, and at the end of February, he got the letter saying you were approved in principle. And now he's filling up all the requirements to become a permanent resident.
Okay, thank you.
Okay, thank you. Okay. Have a nice rest of week.